Good day everyone. Good day ma'am sir. Today we'll be presenting our presentation entitled Telehealth in Nursing. I am Romalyn LANORIA together with my co-presenter LAURENTE Imari, LAVIDAN Chini Rose, MANALO Edel Hydie, MARASIGAN Christine Leila, Mariano Aldrin, MERCADO Charlene, OBRA Lady Grace, PASCUAL Fer Carlo, and POLICARPIO Jenny Rose. We are the student nurses from Nueva Ecija University of Science and Technology, College of Nursing from BSN2F. So let's start with the question, what is telehealth? In post-2000, we had a great technological advancement. This is the time where we have developed the modern technologies like smartphones, tablets, artificial technologies, mobile applications, and many more. And along with the technological advancement, we also had advancement in healthcare. Hospitals try to adapt the newly invented technologies to provide healthcare in different medical fields. The adaptation of healthcare in the new invented technologies made the healthcare system become faster, accurate, and cost-saving for health services, as technologies become more common and accessible nowadays. The technological advancement and the adaptation of healthcare had led to the term telenursing or telehealth nursing. Now, let's define telehealth. Telehealth is defined as the utilization of electronic information and telecommunication technologies for long-distance clinical healthcare, public health and health administration, patient and professional health-related education and training. To put it simply, telehealth is a delivery of health service across a distance. For example, maybe if a patient has a video conference appointment from their home or from a regional hospital directly to a specialist at a main city hospital. Telehealth can be delivered by using simple telephone, also by sharing information. For example, sending a digital image by email. It is another good example of telehealth. Now, how does it help us? In telehealth nursing, the role of the nurse is comparable to in-person visits. We provide care, education, and counseling, while telehealth gives a way to provide actual healthcare aid and support from a distance. So whenever nursing is done in a telehealth setting, nurses can monitor a patient's oxygen level, vital signs, blood glucose, and more. And doctors can check and e-prescribe the patient from a distance. Telehealth is convenient, money-saving, and time-saving for both the healthcare provider and the patient. So what are its uses? Telehealth nursing may be done practically anywhere, and it allows nurses to connect with patients without having to travel, register, or wait as they would with regular checkups and visits. So telehealth nursing can be done anywhere. Nurses can make use of technology to conduct telehealth sessions in their homes, at doctors' offices, in prisons, in schools, and in clinics and hospitals. So basically any place where the proper technology is available and is a suitable place for telehealth nursing. The patients usually find their telehealth nurses through their managed healthcare organization. Nurses must be overseen there to regulate patients' access to the system, and most of the time, the goal is to reduce the number of trips patients make to the ER. But telehealth is not designed to prevent all travel to a specialist or hospitals. While telehealth can be extremely useful for arranged appointments, such as follow-up appointments, the choice of whether to provide service in person or by telehealth should be based on the clinical requirements and the purpose of the consultation.
There are various ways that telemedicine is assisting in alleviating the nursing shortage. First, with the use of telehealth platforms, nurses may help and educate patients in a specific way with very clear goals. Next, telehealth nurses can learn about state-of-the-art therapies in medicine without classified as a small area of traditional nursing. They aren't limited to one department every day. Third, telehealth nursing enables providers to form long-term relationships with patients throughout their illness. Fourth, since there are no interruptions or handovers to get in the way of typical office visits, telehealth nurses establish meaningful contact with patients. Also, telehealth nurses can spend more time with patients because they don't have to travel, draw charts, or run from one patient to the next on-site. Next, with telehealth, nurses are more available to patients, allowing for an acceptable quantity of care to be provided with fewer nurses. Next, nurses have the opportunity to learn about the commercial aspect of their work, broadening their knowledge in other areas. Then last, lower costs, more attention, and better care are all advantages. The nurses may focus more on providing patient satisfaction and care without any limitation, resulting in increased efficiency. To help their telehealth patients, nurses must continue to apply listening, critical thinking, and evaluation skills in the same way they do in traditional settings. Thus, their ears become their eyes, and that they become specialists at picking up on even the tiniest changes in a patient's voice. Advancement of medical technologies. As the population ages, putting more strain on the healthcare system and nursing shortages making it difficult to meet those demands, as the medical community reacts to the coronavirus pandemic, the usage of telehealth nursing has grown. Telehealth services in nursing can help reduce the healthcare costs and improve client outcomes by ensuring that more people have access to timely nursing care.
For the history, based on the book Telehealth Nursing, Tools and Strategies for Optimal Patient Care by Martich Dauna, MSN, RN, using communication tools to provide care to patients or clients is not a new concept. Because of improvements in the telecommunication business, it is only becoming more popular or used. Background: over the next decades, telemedicine evolved further, focusing especially on remote or rural locations with a lack of stable healthcare providers or facilities. During this time, advancement in telecommunication equipment allowed for the addition of supplementary equipment or devices to aid in the monitoring of patients' conditions. Home monitoring devices for blood pressure, weight, heart rate, oxygen saturation, and blood glucose levels, as well as pacemaker effectiveness, are examples of this technology.
Good day! My name is Edel Hydie, DR MANALO. Is telehealth and telemedicine the same? Telehealth is similar to telemedicine but goes beyond it. They both provide public health benefits. Telemedicine is a subset of telehealth that refers solely to remote clinical healthcare services. It involves the use of software and electronic telecommunication technologies to provide clinical services to patients at a distance without an in-person visit. Telehealth refers broadly to electronic and telecommunications technologies and services used to provide care and services at a distance. In 1925, according to Smithsonian Magazine, he anticipated the potential of remote health visits in Science and Invention magazine, and his invention named teledactyl. Tele means distance and dactyl means finger. Thank you.
First employment of telemedicine. The National Aeronautics and Space Administration, or NASA, placed health monitoring devices into astronaut spacesuits to monitor the health consequences of space flight in 1960s. A new wearable technology has been designed to fit into an astronaut's daily routine aboard the International Space Station, or ISS, while monitoring and recording the vital signs. This system, which includes a smart shirt and dedicated tablet application, will help keep an eye on astronauts' health and enable new science by continuously measuring physiological data. Telemedicine was also employed in the psychiatric mental health care population in 1960s, but this time solely to allow healthcare providers to communicate and discuss with one another. In 1967, at Boston's Logan International Airport, the first known use of telemedicine to deliver direct patient treatment was documented. A medical station was built to provide care 24 hours a day, connecting the airport to Massachusetts General Hospital.
So, using satellites to relay information from Alaska in 1971 and microwave technology to connect people of an Arizona Indian reservation with care providers in 1972. Several hospitals Initiatives were also founded by the U.S. Department of Health, Education, and Welfare in the 1970s to show the use of telemedicine programs that were launched, one in Boston for nursing home residents and another in Miami, Florida at Jackson Memorial Hospital.
So let's talk about its uses. According to Advent Health University, telehealth can be utilized to help inpatient consideration, giving nurses an approach to screen the patient well-being after they are released from the emergency clinic or while they are dealing with a constant illness at home. So for the remote service delivery, nurses deliver services utilizing different instruments such as computers, distant observing gadgets, cell gadgets, and conveyance organizations, and it blends sound, which is the audio, the video, and text-based data. Nurse practitioners have to come to perceive that the nature of telehealth services matches that of in-person office visits. And telehealth devices enormously increment effectiveness for nurses who convey service to clients in country networks and inadequately populated regions. A similar innovation permits practitioners to persistently monitor the patient's conditions, and nurse practitioner utilizes devices that replace customary clinical devices like stethoscopes, thermometers, and the blood pressure cuffs. So for the financial savings, telenursing can decrease costs for the patients and specialists, which is as of 2017 from the Health Affairs, the study found out that on the average, an office visit cost patient $146 or 7,133 pesos, while in the other side, the telehealth visit costs just $79 or 3,860 pesos. Investment funds likewise incorporate diminished appearance, cost, and efficiency gains from diminished worker and lucky deficiencies. The telemedicine general worth is expected to surpass $64.1 billion by 2025 as per Global Market Insights. For the improved bed allocation, it improves follow-up care to high-risk clients. Telenursing offers a tool that reduces readmissions considerably. It uses questionnaires and provided health-related education every week. Follow up in person only with those participants who were out of range of the service during a particular period.
Accessibility by patient in the remote areas. With the use of this telehealth technology, those people or client who seek healthcare assistance for remote areas can have a higher quality care. And those patient or people who struggling with substance abuse disorder and mental health conditions can get a huge help from this telehealth technology because they cannot just walk in a clinic to ask for assistance about their conditions because they might feel embarrassed or some people might think they are crazy or might not think straight. And the second one is increased healthcare employment opportunities. With the use of these telehealth technologies, those unemployed healthcare workers can have a job, and those people from remote areas can have access to this healthcare.
Today I am Fer Carlo, and for the future directions, telemedicine has been a distinct advantage, a lifeline, even for a few socioeconomics, including the old individuals living in far-off regions and those in network without satisfactory medicine service choices.
I'm General POLICARPIO, and I'm going to discuss about utilizing telemedicine. So the use of telemedicine allow for better long-term care management and patient satisfaction. First is telehealth may reduce admissions and emergency room visits because The medical issues can be monitored regularly and be treated before they get worse, and the nurse will be able to care for more patients and on a more regular basis, thereby increasing convenience for the patients and reducing the amount of potential trouble required for both patients and physicians. So, telehealth offers a new means to locate health information and communicate with practitioners. For example, they can use email and interactive chats or video conferences to communicate with their practitioners. Next is, telehealth nursing has a bright future for both patients and healthcare providers because given all the benefits and advantages of telehealth nursing for both patients and healthcare providers like convenience, faster results, high quality care, accessibility, and inexpensive patient's comfort with virtual patient and clinician communication is growing as technology progresses. And some institutions have more than doubled their telehealth sessions because telehealth provide opportunities to make healthcare more efficient, better coordinated, and closer to home. Next is, telehealth is not only more cost-effective than hospitalization, but also results in faster treatment times and reduced delirium rates because telehealth connects the convenience, low cost, and ready accessibility of health-related informations and communication using the internet and associated technologies. Beginning with the use of telephone consults, telehealth has become more sophisticated with each advance in technology and now involves telecommunication and computers to provide healthcare information and services to the clients at multiple locations.
Telehealth technology has the potential to improve the efficiency, improve care coordination, and accessibility of healthcare. In the future, home telehealth technologies will grow increasingly complex and integrated. Another clear future direction is for home monitoring devices to become considerably more portable, with wireless technology likely to be used. Gaps in treatment abuse of medical care, incorrect pharmaceutical use, and unneeded or overlapping care can all result from fragmented care. Other considerations such as ability to pay for telehealth services may restrict their potential benefits. Because of regional internet availability or the expense of mobile devices, those persons who might benefit the most from greater access to care might be hindered.